Good morning. We are going to have a short lecture because we are short of time. I think we have to empty this hall by 9 o'clock. So I'm going to be very, very brief. I'll shift to Marathi in between for the sake of understanding. If you have any queries, please stop me at that time. Otherwise, we can have a discussion when we eat for breakfast after today's talk. Okay, so without wasting any further time, I'm going to start with my talk today. Topic which I have chosen is approach to short stature. As practicing doctors, one of the commonest referral to us is a child not thriving well, which could be height as well as weight. बाळ खूप बारीक दिसतो, वयापेक्षा उंचीला कमी वाटतो, are the common complaints which the parents comes to us. So in today's talk, I'm going to brief you how to approach a child with short stature. Does he or she actually need investigations? And how should you go about when you get a child who is short in stature? Like I said, it is the commonest problem which we face as general practitioners or for that matter as endocrinologists in our practice. And short stature by itself is not a diagnosis, but could be a presenting symptom of various illnesses, which could be systemic illnesses, nutritional disorders, endocrine disorders, or for that matter, psychological aspects as well. So short stature could be just a presentation of any underlying systemic illness. That's why a systematic approach will help us to diagnose the etiology as well as treat the child with short stature. Okay, how do we define a child with short stature? If you go to a textbook presentation, it tells you that a child who is below 2 standard deviation for height and weight for the height is considered to be short. Now, how many of us will actually know what 2 standard deviation means for that age in our busy OPD? If a child comes in, if you go by the definition, hardly anybody of us can pick up the 2 standard deviation definition for a child who is short. That's why we have made it a bit simple. A child can be considered as short when compared with population centiles, the parent's height, or child's own previous centiles. What is this? I'll just discuss it briefly. Now, when you apply these 3 criteria, a child can be considered short when he or she is below the 3rd percentile for the population, his height is less than the mid-parental or target height, or he shows growth velocity which is poor, which is less than 25th percentile on the velocity charts. Okay, so child can be considered short if his height is below the 3rd percentile, he is shorter than the target height or outside the target range, or he shows deceleration on the growth velocity charts. Does being short actually matter to anybody? Few examples. All of us know who this man in the red shirt is? He is Messi, one of the best football players we have today. Do you know what he was suffering from or what does he suffer from? He was diagnosed to have growth hormone deficiency at the age of 4 years. He couldn't afford growth hormone therapy, so it was taken by Barcelona club and they paid for his treatment. And you can see after getting some 15 years of treatment, Messi is now what Messi is, but he's still shorter than most of his colleagues in the team, right? So being short to Messi does not matter. But for somebody like him, this chap is the French president, the ex-French president. Look at what he is doing. Try to match his wife for a photo op with the US president. So it can have social implications. The same man here trying to be taller than this lady standing next to him. And this is a French president again who is trying to honor a French athlete with some medals. So being short for them probably matters. For Messi, it did not matter. Okay. So if I have a child who comes to me in the OPD and the parents say that he is short, what can I do? I can measure the child's height and length. I can measure the child's weight, his head circumference, and body mass index, and plot all of them together on a single parameter, which is the growth chart. So simple plotting on growth charts gives a very fair idea of what to expect in a child who is short. I have written length and height here. Do you know any difference between the length and height? Anybody can tell me what is the difference between length and height? What is the basic difference between length and height? When you measure somebody in a lying posture, it is called as length. When you make somebody stand and you measure him or her, it is called as height. The difference is when you lie down, or when you stand up, you are standing against gravity, right? So the pad of fat in your soul gets compressed, the intervertebral disc gets compressed, so your own height is less than your own length by about 1 to 1.5 centimeters. Okay? For a child below 2 years of age, standing becomes difficult in the way we want him to be. That's why we measure length below 2 years of age and we measure height only after 2 years of age. Okay? Fine. So what are growth charts? Growth charts are percentile curves prepared from population-based studies where anthropometric measurements are collected over a period of time from large number of children and are usually they are in a cross-sectional manner. Growth charts provide us with graphical tool to help assess a pattern of growth. They are much better to follow than serial values. So if I give you a table and ask you to read it, you may not be able to actually interpret it. If I show you a chart, anybody can easily follow. The examples of which I'll show you shortly. So the growth charts are the tool which we use for charting anthropometry. We all know this, Dr. Khadilkar, who is from Pune, a well-known pediatric endocrinologist, my teacher and guide. He was the person instrumental in developing growth charts for IIP in 2015, which are now used by all of us in our clinical practice. They are pan-India representatives, so their data is collected from children from all the parts of the country. Hence, they can be used for the entire country to assess the children's height and weight. And this is the example of the new growth charts. As a rule, blue is for boys, pink is for girls. This is a boys chart showing the weight percentiles and the height percentiles. Okay. Behind that, we have the BMI cutoffs. So BMI, we have the similar percentiles like what we had for height and weight. In addition to this, we have two lines here, the orange line and the red line, which are the BMI cutoffs for equivalent to 85th and 95th percentiles, equivalent to 23rd adult or 27th adult cutoffs respectively. We'll discuss this briefly. This is an example of a pink chart for girls, again same height and weight and BMI. Some people wanted, now if you look carefully, these charts start from the age of 5 years. Okay. There was a suggestion by a lot of pediatricians that in our busy OPD we get children who are 3-4 years old and we can't use these charts because they are of 5 years. So could you give us charts which start from the age of 2 years? That was attempted, and this is what the chart right from birth till 18 years show. But if you look carefully till 5 years of age, there is so much crowding here. The lines are so close that plotting on these charts will give us no information. So these charts, though made, are not used. What we follow is the IIP charts up to 5 years. And before that, we follow something called as WHO charts, which look something like this. This is a WHO chart used for children from 0 to 5 years of age. Again, you see this is a blue chart for boys. Now, what does it have? The weight percentiles, the length percentiles, and the head circumference. Okay? Instead of BMI, here we have weight for height. Okay? Charts. So these are the WHO charts which are used for children below the age of 5 years, and they have weight, the length, the head circumference, and the weight for height on there as the chart. This is for girls, the same chart. And just to complete the list, we have disease-specific charts which are used in children who have specific illnesses. For example, this is the achondroplasia chart. This is a Down's chart for a girl, and this is the velocity chart which I was talking about. Okay. Again I'll come to this. The velocity chart is slightly different than what we saw with the growth charts. The red line and the green line are indicative of early and late puberty, which I don't want you to concentrate today. Just remember there's something called as velocity chart, which is not readily available. That's left to a specialist to comment upon it and use it. But there is something like a velocity chart which is available and which you can use if you want to. In addition to this, when you are assessing a child with short stature, one has to look at the Tanner staging, which also is called as sexual maturity staging, SMR, to tell us the stage of puberty in which a boy or girl is, which help us to implicate the cause for his or her short stature. This is a rough cartoon showing you assessment of the sexual characters. For a girl, we look at the axillary hair, the pubic hair, the breast development and menarche. In the boy, we look at the axillary hair, the pubic hair, the size of the phallus, and a testicular volume in the Tanner staging. Just to tell you the exact way of taking the height, it will be taken this way by making the child stand straight, which is head, shoulders, buttock, and foot touching the wall or the flat surface, and the observer observing directly with his or her plane parallel to the point where it is measuring. This is not the way of measuring the actual height. Look at where the child is standing, so it's missing on actual calculated length, plus the observer's angle is not right. Okay, so please measure the height of the child by using proper technique and proper method with the lowest of 0.1 centimeter. So height can be 141.1 centimeter. Okay. So lowest of 0.1 centimeters. Anything is fine. Only thing is तुम्ही ते जे उभं करता मुलाला ते योग्यरित्या करा. This is called a stereometer, which we use. Now the best way of getting a stereometer is the company person who's standing here can provide it to you. It's a bit costly instrument, so they may not give it to all. It costs about 30,000-40,000 rupees because it's made that way. Otherwise, you have something like the one which is pulled down. That is very, very easy to use, provided it is fixed at a proper length. Because what happens is you should take the entire tape out बघायचा. ते साधारण 5 फूट असतो. तेवढं बघून आपण ते फिक्स करायचं. आपण समजा लावतो आणि तो इथंच कुठेतरी संपतो आणि आपण ते खालचं मोजत नाही. त्यामुळे ते फिक्स करायचं बरोबर मेजर तुम्ही फिक्स केलं तर इट इज ऍक्च्युअली गुड टू यूज. जे तुम्ही आपण चार्ट लावतो ओपीडी मध्ये तेही चालतील, फक्त ते फिक्स करताना व्यवस्थित करा. ते टायमिंग बाहेर आलं तर कित्येक वेळा ते पुढे मागे होतं आणि मग आपल्याला ऍक्च्युअली हाईट मिळत नाही. सो इफ यू स्टिक इट प्रॉपरली इट इज ऍक्च्युअली absolutely useful to use. Anything is absolutely okay. 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 So now we go to the components of growth chart. What does growth chart contain? It has the x-axis and the y-axis. Barabar? On the x-axis, we have age in years or months. Okay. On the y-axis, we will have height, weight, the head circumference or BMI. We just saw the growth chart. If you want, you can see the charts which are given to you. So on the x-axis, we have age in years or months. On the y-axis, we have either the height, the weight, the head circumference or the body mass index. Each chart has 7 percentile lines, which represent the 3rd, 10th, 25th, 50th, 75th, 90th and 97th percentile. So प्रत्येक growth chart मध्ये x आणि y axis असतो आणि आपल्याला 7 percentile lines असतात. Okay, for weight as well as for the height. The 50th percentile is taken as the average line. Okay. Just to give you example, same chart which we had. So we have 7 lines, 3, 10, 25, 50, 75, 90, 97 percentile. बरोबर? हे height ला आणि हे weight ला आणि 50th percentile आपण average धरतो दोन्हीसाठी, height साठी आणि weight साठी. The BMI charts are slightly different, which we just saw. In addition to these lines, they contain 2 more percentile lines, which are the 85th and 95th cutoffs, which are represented by orange and red, equivalent to 23rd and 27th identity equivalent, which are indicative of obesity, overweight and obesity respectively. थोडक्यात काय, आपण BMI प्लॉट केला आणि तो या भगव्या रेषेच्या खाली असेल कुठेही तर तो मुलगा किंवा मुलगी नॉर्मल आहे. ओके. जर का लाल आणि भगव्याच्या मध्ये असेल तर तो ओव्हरवेट आहे आणि लालच्या वरती गेला तर तो ओबीज आहे, स्थूल आहे असं म्हटलं जातं. ओके. दिस इज द आयडिया टू गिव्ह यू द BMI gives you idea of obesity. So if you are between red and orange, you are obese. If you are above red, you are overweight. Sorry, you are overweight. Above red, you are significantly obese. Okay. So that is the use of BMI charts. Okay. Some charts are SD scores. I don't want to go into that. But आपण चार्ट बघितला पण त्याचा उपयोग काय हो? Any reading which crosses 2 percentile lines, either upwards or downwards, is a sign of abnormality. म्हणजे काय, मी आज माझी उंची 25 पर्सेंटाईल ला आहे. आफ्टर 6 months यू सी आय एम ऑन 75 पर्सेंटाईल, म्हणजे मी खूप जास्त वाढतोय, काय तर चुकतंय. किंवा मी आज 50 पर्सेंटाईल ला आहे, नेक्स्ट टाइम मी 50 लाच राहिलो किंवा 25 ला आलो तर काहीतरी चुकतंय. सो आयदर अपवर्ड्स और डाउनवर्ड्स 2 percentile चेंज ओव्हर अ पिरियड ऑफ टाइम इज अ साइन ऑफ abnormality. ओके. ओके. हाऊ डू यू अप्रोच शॉर्ट स्टेचर? आपल्या डेफिनेशन तुम्हाला आठवत असेल, पहिले मी सांगितलं होतं लेस देन 3rd percentile, म्हणजे आपल्या चार्ट मध्ये मुलगा 3rd percentile खाली असेल तर तो शॉर्ट आहे. ओके. सेकंड आय सेड इफ ही शॉर्ट फॉर द फॅमिली हाईट. व्हॉट इज फॅमिली हाईट? आय एम टेलिंग यू नाउ. आपल्या प्रत्येकाची उंची जी असते ती अनुवंशिक असते. ओके. एखादा मुलगा किंवा मुलगी किती उंच होईल हे आई वडिलांच्या उंचीवरती अवलंबून असतं. म्हणून आपल्याला आई वडिलांची उंची घेणं गरजेचं असतं. त्याच्यावर आपण काय काढतो? आपण काढतो मिड पेरेंटल हाईट, ऑल्सो कॉल्ड ॲट टार्गेट हाईट. आता टार्गेट हाईट कशी काढायची? त्याचा एक फॉर्म्युला आहे. मुलांसाठी आणि मुलींसाठी वेगळा असतो. मुलांमध्ये काय करायचं? आईची उंची म्हणजे मदर्स हाईट प्लस फादर्स हाईट प्लस 13 सेंटीमीटर्स, एव्हरीथिंग डिवायडेड बाय 2. जे काय येईल त्या मुलासाठी टार्गेट हाईट झाली. ओके. समजा आईची उंची 140 सेंटीमीटर आहे आणि वडिलांची उंची आहे 160 सेंटीमीटर. आपण काय करणार 140 प्लस 160 300 बरोबर प्लस 313 डिवायडेड बाय 2 जो काय फिगर येईल तो त्या मुलाची टार्गेट हाईट झाली. ओके. तसंच मुलींसाठी मदर साईट प्लस फादर साईट मायनस 13 एव्हरीथिंग अपॉन 2. ओके. म्हणजे समजा आईची 140 आहे वडिलांची 60 आहे किती झाले 300 मायनस 13 287 डिवायडेड बाय 2 जो काय फिगर येईल तो त्या मुलीसाठी टार्गेट हाईट झाली. ओके. टार्गेट हाईट फॉर अ बॉय अँड गर्ल. नाउ दिस इज जस्ट अ फिगर. There is a range of 6 centimeters above and below it. It represents the 90th and the 10th percentile for the family. Okay. And this is called as target range. म्हणजे एखाद्या मुलाची उंची किती होईल समजा त्याचा टार्गेट आपल्या 150 आली समजा तर 156 पासून 144 पर्यंत या रेंज मध्ये तो मुलगा किंवा मुलगी मोठा झाल्यावरती असणार आहे. ओके. दिस इज कॉल्ड ॲज टार्गेट रेंज. सो टार्गेट हाईट म्हणजे काय मुलासाठी फॉर्म्युला मदर साईट फादर साईट प्लस 13 अपॉन 2 मुलीसाठी फॉर्म्युला मदर साईट फादर साईट मायनस 13 अपॉन 2 जो काय आकडा येईल त्याच्या वरती आणि खालती 6 सेंटीमीटर इज अ टार्गेट रेंज. ओके. आता टार्गेट रेंज काढली तर चार्टमध्ये प्लॉट कुठं करायची तर प्लॉट इन द एज ऑफ 18 years. Anybody can tell me why at 18 years? My child is 7 years. Why you want me to plot at 18 years? Because we expect the growth to be completed by 18 years. Okay. 18च्या पुढे आपली वाढ शक्यतो होत नाही. So at the age of 18 years, we can plot it on the growth chart. कसं करायचं एका मिनिटात आपण बघूया. तुम्हाला कन्सेप्ट कळला का टार्गेट हाईट टार्गेट रेंज म्हणजे आपण शॉर्ट त्याच्या म्हणणार असलो सेकंड डेफिनेशन प्रमाणे तर ही ऑर शी शुड बी बिलो द टार्गेट रेंज. बरोबर. समजा माझ्या मुलीची उंची 140 आहे आणि टार्गेट रेंज 144 आहे तर ती मुलगी शॉर्ट आहे. बरोबर बिकॉज ती 144 पेक्षा खाली आहे. शॉर्ट स्टेशन म्हणजे काय 3% खाली असला तर किंवा टार्गेट रेंजच्या बाहेर असला तर यू आर शॉर्ट. ओके. ठीक आहे. आता एखादा मुलगा आपल्याकडे आला तर खरं शॉर्ट आहे आपल्याला कसं कळणार हो तर सगळ्यात पहिल्यांदा त्याचा ऍक्च्युअल वय विचारायचं आणि वयच्या महिन्यात पाहिजे आपल्याला. जन्मतारीख काय बाबा 25 ऑगस्ट 2095 तर तसं पाहिजे. 12 वर्ष तर 12 वर्षाला काही अर्थ नसतो म्हणजे 12 वर्ष 1 महिना आहे का 12 वर्ष 10 महिने हे आपल्याला कळत नाही. सो ऍक्च्युअली बर्थ डेट विचारायची त्याप्रमाणे एज कॅल्क्युलेट करायचं. ते एज कॅल्क्युलेट केल्यावरती आपण ग्रोथ चार्ट वरती प्लॉट करायचं. 9 वर्ष 3 महिन्याला 120 सेंटीमीटर आहे. 9 वर्ष 3 महिन्याला आपण 120 सेंटीमीटर हाईट आणि वेट प्लॉट करायचं. देन यू टेक द हाईट ऑफ द पेरेंट्स. ओके. फ्रॉम दॅट यू कॅल्क्युलेट द मिड पेरेंटल हाईट. देन यू कॅल्क्युलेट टार्गेट रेंज and then you compare the plotted height for the percentiles on the chart plus for the family and then interpret the results as the child are being short or not short. Okay. Remember to use proper growth charts. Children below 5 years of age, please use the modified WHO charts and above 5 years of age, we are going to use the IIP charts. So IIP charts above 5, below 5, the WHO charts. Okay. They are easily available free of cost on the net. So just go to IIP website, put growth charts, one mail, download करा, xerox करून ओपन ठेवलं तरी हरकत नाही. It is very easy to use. Just to give you idea, म्हणजे आपल्या बिझी ओपीडीत जर काय मुलगा आला तर बाबा ठीक आहे बुटका दिसतोय मला पण याचं कारण काय असेल तर एक बेसिक आयडिया असते जे समथिंग कॉल्ड एज ICP मॉडेल ऑफ ग्रोथ. ICP म्हणजे इन्फन्सी चाइल्डहुड आणि प्युबर्टी. ओके. जर काय काय मुलगा तुमच्याकडे इन्फन्सी मध्ये आला म्हणजे वय वर्ष 1 किंवा 2च्या पेक्षा कमी आला तर त्याचं कॉज जनरली न्यूट्रिशनल असतं म्हणजे आहारात काय तर चुकतंय किंवा विनिंग चुकतंय म्हणून हा मुलगा वाढत नाहीये. सो इफ यू कम इन इन्फन्सी जनरली द कॉज इज न्यूट्रिशनल. इफ यू हॅव अ चाइल्ड हु इज शॉर्ट जनरली इट इज आयदर ग्रोथ हार्मोन डेफिशियन्सी or thyroid hormone deficiency. And if you have a child who is short in puberty, it is generally the sex steroids or steroid hormones which are deficient. So if you have a broad idea like this, generally you get an idea of how to approach the child. So ICP model is important to give us a clue of what can be the underlying etiology in a child who is short. आता उंची वाढते कशी आपल्याकडे ग्रोथ चार्ट पण नाहीये आता पण आम्हाला मुलगा शॉर्ट आहे की नाही बघायचं. आपली उंची वाढते कशी आपल्या सगळ्यांना माहिती आहे यू आर 50 centimeters at birth, 75 centimeters at 1 year. So you grown about 25 centimeters in the first year. To make it simple, I have shown you made it 24 centimeters. म्हणजे पहिल्या वर्षी मुलाची वाढ 24 सेंटीमीटर व्हायला पाहिजे. त्याच्या पुढच्या वर्षी त्याच्या निम्मी म्हणजे 12 सेंटीमीटर. तिसऱ्या वर्षी त्याच्या निम्मी म्हणजे 6 सेंटीमीटर आणि 4थ्या वर्षापासून प्युबर्टी पर्यंत रफली 4 to 5 सेंटीमीटर्स पर इयर. ज्याचा एवढा आपला मुलगा किंवा मुलगी वाढत असेल तर आपला मुलगा किंवा मुलगी नॉर्मल आहे. एनिथिंग which is not matching this formula, think about investigating. Once you hit puberty, a girl grows by about 7 to 9 centimeters per year, a boy grows by 9 to 11 centimeters per year till your puberty is complete. Okay, so this is a rough formula how to expect a normal growth in a child as far as length is concerned. Other thing which you have to look for is something called as body proportions. म्हणजे काय असतं, अपर सेगमेंट लोअर सेगमेंट रेशो. आता हा कसा काढायचा, आपण अख्खी आपली हाईट घ्यायची जी आपण आता बघितली तशी. देन फ्रॉम द प्युबिक सिम्फायसिस टू युअर फुट यू टेक द लोअर सेगमेंट. ओके, तुम्हाला लोअर सेगमेंट मिळाला, आपल्याकडे हाईट आहे, हाईट मधनं लोअर सेगमेंट मायनस करायचा, जो येईल तो अपर सेगमेंट. ओके, अपर सेगमेंट आपल्याला मोजता येत नाही बऱ्याच वेळेला, बिकॉज आपला स्पाइन कर्वेचर कसा असतो सांगता येत नाही, झोपेल कसं सांगता येत नाही, म्हणून आपण लोअर सेगमेंट घेतो विच इज फिक्स्ड. सो अपर सेगमेंट मायनस लोअर सेगमेंट, total length minus lower segment gives you the upper segment. And once you have that, you take the ratios of upper segment to lower segment. The ratio is 1.7:1 at birth and gradually goes on decreasing. It becomes 1.1:1 at the age of about 8 years of age. Okay. Ata, if you are short, there are issues or causes which can give you disproportionate short stages. I can either have a short spine or short leg. बरोबर. जर का माझा अपर सेगमेंट छोटा असेल तर मला प्रॉब्लेम माझ्या स्पाइन मध्ये, मग मला काय होऊ शकतं, ट्युबरक्युलोसिस असू शकतो, पॉट स्पाइन, म्युकोपॉलिसॅकॅरायडोसिस आर कॉमन कॉजेस ऑफ शॉर्ट अपर सेगमेंट. शॉर्ट लिम्ब body disorders, achondroplasia, hypochondroplasia, rickets will give me short limbs. So if I have short limbs, I have different causes. If I have short trunk, I have different causes. आणि हे आपल्याला चाइल्डचं प्रपोर्शन काढून लगेच बघता येतं. So always, if you are suspecting short stature, take the upper segment, lower segment ratio. Again, gives you a clue toward disproportionate or proportionate dwarfism, short stature. Look for clinical clues, which will again tell you the cause. This is a girl who is about 12 years. If you look at her carefully, she has no secondary sexual characters, webbing of the neck, low set ears. When I hospitalized, she had a murmur as well. We are looking at Turner syndrome. Correct. This girl is a case of Downs. You cannot see classically because I have covered it. But syndromic features can be picked up in children easily, and that can again tell you why the child is short. Again, we said do SMR in all the children. Now let us see a couple of examples to give you a better understanding of what we just discussed. This is a boy who is 9 years old. His height is 119 centimeters and weight is 18 kg. आता आपण या ग्रोथच्या प्लॉट केलं तर कसं करायचं, 9 वर्षाला उंची आहे 119 सेंटीमीटर, बरोबर. सो वी प्लॉट हिम हियर, आणि याचं वेट आहे 18 किलो. सो वी प्लॉट हिम हियर, समथिंग लाईक दिस. दिस इज वेअर वी स्टार्ट. आपण प्लॉटिंग सुरू केलं की आपल्याला हाईट वेट प्लॉट करता आली, बरोबर. मग आपण आई वडिलांची उंची घेणार. आईची उंची आहे 150 सेंटीमीटर, वडिलांची आहे 57 सेंटीमीटर. आपण फॉर्म्युला वापरला, कुठला, मदर साईट प्लस फादर साईट, मुलगा आहे म्हणून प्लस 13, जे काही येईल तर सगळ्यांनी दोन्ही भागलं, तो आला आकडा 160 सेंटीमीटर, बरोबर. तर ही रेंज 6 सेंटीमीटर वरती आणि खालती आपण म्हटलं, म्हणजे 166 पासून 154 पर्यंत टार्गेट रेंज झाली. ती कशी प्लॉट करायची ग्रोथ चार्ट वरती, ऍट द एज ऑफ 18 इयर्स. ऍट द एज ऑफ 18 इयर्स 160 ला प्लॉट केलं, 6 सेंटीमीटर्स वरती 6 सेंटीमीटर्स खालती, ही टार्गेट रेंज झाली, बरोबर. तर आपल्या ओपीडी पेशंटचं आपण सगळं हे केलं. आता मला बघून सांगा, हा मुलगा शॉर्ट आहे का हो. जर का आपण बघितलं तर हा जस्ट 3rd ते थोडंसं खाली आहे. सो इफ यू गो बाय डेफिनेशन आपल्या पूर्वीच्या, लेस दॅन 3rd इज शॉर्ट. मग हा शॉर्ट होतो का, तिथं जरी शॉर्ट असला तरी हा आपल्या फॅमिलीसाठी नॉर्मल आहे की नाही हे बघण्यासाठी इट इज समथिंग कॉल्ड ॲज कन्स्ट्रक्शन ऑफ 3rd पर्सेंटाइल फॉर द फॅमिली. तर काय करायचं, एक रेज या खालच्या रेगेपासून आपल्या वाय ऍक्सिस पर्यंत ड्रॉ करायची, समथिंग लाईक दिस. ओके. आता हा मुलगा रेगेच्या वरती आहे ना, म्हणजे आपल्या फॅमिलीसाठी जो नॉर्मल चाललाय, त्यामुळे हा शॉर्ट स्टेज जरी वाटला वडिलांना आई वडिलांना तरी हा शॉर्ट नाही. ओके. तर या मुलाला मला कुठली हायफाय इन्व्हेस्टिगेशन करायची गरज नाही. आय कॅन सेफली फॉलो हिम रेग्युलरली अँड सी हाऊ ही इज ग्रोईंग. इफ इज ग्रोईंग ऍज पर दिस ग्रोथ चार्ट सेंटाइल्स, वी आर हॅपी, दिस चाइल्ड इज नॉर्मल. He could be example of familial short stature. बरोबर. So doing a simple growth chart plotting saves the patients from investigations, unnecessary treatment, and reassures the parents and the doctor that everything is fine. Okay. आता हाच मुलगा माझ्याकडे 6 महिन्यांनी आला, तो होता 119 सेंटीमीटर, आता आला माझ्याकडे 6 महिने 122 सेंटीमीटर आहे. बरोबर वाढतोय का हो? किती वाढला तो? 6 महिन्यात 3 सेंटीमीटर. बरोबर. मग रफली वर्ष किती वाढेल तो? 6 सेंटीमीटर. 6 महिन्यात 3 म्हणजे वर्षाला 6 सेंटीमीटर. बरोबर. आपण काय म्हटलं होतं? 4 to 5 centimeters per year below the age of till puberty is normal. He is going 6 centimeters. So is he normal? He is normal. So without doing a single test, just for the child 3 monthly to 6 monthly, I have devised that this child is normal. मला कुठली तपासणी करायची गरज नाही. बरोबर? This is the use. Any question? Okay. This is what, and again if you want you can plot him on the growth velocity chart, something like this. आता मी म्हटलं होतं की 50th percentile is average for growth chart. तसं 25th percentile is a cutoff for velocity chart. A child who is below 25th percentile is abnormal for a velocity chart. Okay? Okay, अजून एक एक्झाम्पल. हा आता मुलगा आहे 11 वर्षाचा, त्याची उंची 125 आहे आणि वेट 17 किलो आहे. टार्गेट 170 आहे. दिस इज हाऊ इट लुक्स ऑन द ग्रोथ चार्ट. आता मला सांगा, हा मुलगा शॉर्ट आहे की नाही? कशामुळे? बाय व्हॉट क्रायटेरिया? इज बिलो 3rd percentile and way below the target range. बरोबर. सो डेफिनेटली शॉर्ट आहे मान्य आहे. बरोबर. आता शॉर्टनेसचं कारण शोधायला काय करायचं? There is a concept of height age and weight age. I don't want to go in details about that, but what you can do is we can plot something like a height age by drawing a line parallel to the x-axis from this point up to the 50th percentile and then dropping a perpendicular from there to the x-axis. म्हणजे असं. ओके. या पॉइंट पासून आपण 50 सेंटीमीटर पर्यंत लाईन ड्रॉ केली, तिथनं आपण परपेंडिक्युलर ड्रॉप केला. ज्या पॉइंटला कट होईल तो आपल्याला देईल हाईट एज, आणि तसंच वेटला आपण केलं तर तो दिसेल वेट एज. कळलं? आता या मुलाचं ऍक्च्युअल वय आहे 11 वर्ष, त्याचं हाईट एज आहे 7.8 years आणि वेट एज आहे 5 वर्ष. बरोबर. सगळ्यात जास्त काय अफेक्टेड व्हायचं या सगळ्यांमध्ये? वेट एज. बरोबर. सगळ्यात छोटं वेट एज आहे. म्हणजे काय आहे? हा मुलगा बुटका पण आहे आणि बारीक पण आहे, पण सगळ्यात जास्त त्याचं अफेक्टेड काय आहे? वेट. दिस गोज इन फेवर ऑफ chronic malnutrition or chronic long-standing illness. बरोबर. So without doing a single lab test, just by doing 3 or 4 basic steps, I know this, and I'm looking at a chronic long-standing illness or chronic systemic disorders. Then I can plan my investigation based on my approach. Okay? बरोबर. Full term. One more example. This is a girl who is 10 years old. तिची हाईट 110 सेंटीमीटर आहे, वेट 22 किलो आहे, टार्गेट 157 आहे, रेंज आपण बघितली आहे मगाशी. आता या मुलीचं हाईट एज जर का मी काढलं तर ते आहे 5.5 वर्ष आणि तिचं वेट एज आहे 7.5 वर्ष. ओके. मुलगी आहे 10 वर्षाची, हाईट एज आहे 5.5 वर्ष, वेट एज आहे 7.5 वर्ष. आता यात सगळ्यात जास्त अफेक्टेड काय आहे? हाईट आहे. म्हणजे वेट रिलेटिव्हली स्प्रेड आहे. ती बुटकी आहे, वेट पण कमी आहे, पण सगळ्यात अफेक्टेड जास्त काय आहे? हाईट आहे. वेट इज रिलेटिव्हली स्पेअर्ड. ओके. सो वेन यू हॅव दिस कन्सेप्ट, it generally goes in favor of endocrine disorders or syndromic features or skeletal dysplasia. Most commonly, it is endocrine disorders. If you have hypothyroidism, growth hormone deficiency, त्यांचे growth charts असे असतात. ओके. हाईट वेट दोन्ही कमी आहे, पण जास्ती अफेक्टेड आहे ते हाईट आहे. वेट इज रिलेटिव्हली स्पेअर्ड. ओके. सिंपल थिंग टू रिमेंबर, शॉर्ट अँड ओबीज, मी ओबीज म्हणजे जाड म्हणत नाहीये, रिलेटिव्हली वेट स्पेअर्ड. शॉर्ट अँड ओबीज थिंक ऑफ एंडोक्राइन डिसऑर्डर. ओके. टॉल अँड ओबीज थिंक ऑफ न्यूट्रिशनल डिसऑर्डर्स. ओके. वेट पण खूप जास्ती आहे, उंची खूप जास्ती आहे, थिंक अबाउट न्यूट्रिशनल. वेट कमी अफेक्टेड आहे, हाईट बुटकी आहे, शॉर्ट अँड ओबीज थिंक ऑफ एंडोक्राइन डिसऑर्डर्स. ठीक आहे. आपण डायग्नोज केला तर तपासण्या कशा करायच्या? ऍज अ बेसिक टेस्ट वी शुड रूल आउट सिस्टमिक डिसऑर्डर्स or chronic illnesses which affects your height. So always do a hemogram to look for anemia. ESR gives a clue to tuberculosis. Renal function tests, mainly creatinine, to diagnose renal failure. Calcium phosphatase, phosphatase, thyroid function test can give a clue to the systemic disorders. If possible, and if you want to do a bone age, because of lack of time, I'm not going to go into details about bone age just now, but bone age can also be used as a parameter to diagnose underlying short stature causes. So we can do this basic test. If they're abnormal, obviously we start treatment. If no, then we have to go for a second line therapy, which I'll just discuss shortly. But always remember, in a girl who is short and we cannot find a cause, unexplained short stature in a girl, always rule out turnus. Okay? Turners can manifest any age and any way. So unless you have a high index of suspicion, we will miss it. Okay. So for any short girl with unexplained cause of short stature, always rule out Turners by doing a USG and a karyotyping. Okay, so once you couldn't find the cause by doing the basic test, everything is normal. The next step of investigations includes the second line test, which includes IGF-1 levels, IGF-BP3 levels, growth hormone stimulation tests, and neuroimaging. As a rule, and my suggestion would be to leave this test to specialized consultants and specialized centers, because they have to be done in a specific way by doing certain protocols. So it is best to refer a child if you suspect the second level of investigations to be done. Simple chart to approach child with short stature. First and foremost, see if the child is short by satisfying definition. Yes, he is short. Does it look normal? Yes, he is looking normal. Look at the growth velocity. Growth velocity is normal. The child is short, normal child. It could be either familial short stature or idiopathic short stature. Growth velocity not available or is low. Do a bone age. The bone age is normal. We again shift to the normal familial short stature. Bone age is retarded. Looking at endocrine, systemic illnesses, something like that. Look at the child again, abnormal looking, take the proportions. Proportion is disproportionate, mild disproportion can happen in hypothyroidism or CVGP, but severe disproportion, short limb or short spine. If you have short limb, we are looking at skeletal dysplasias, short spine, Cox or mucopolysaccharidosis. If he or she has syndromic features, that features should tell us which syndrome we are dealing with. Okay? If you can just xerox this chart and keep it at your place, you can easily approach a child with short stature. To make it more simple, now this is available free of cost on your Play Store. You can just type IIP Growth Charts. It spits out this. When the person comes, you just enter boy or a girl, put the height, weight of the child, and it just gives you the patient's height, weight on the growth chart appropriate for the child's age. It plus gives you the interpretation also. This girl is extremely short. Z score is just -3, child is severely stunted. So हे पण तुम्हाला बघता येतं ओपीडी बसला पेशंट दाखवता पडत हे बघा तुमच्या मुलाची उंची नॉर्मल आहे ॲबनॉर्मल आहे जे काय आहे ते. This is a very simple way of doing it. You can just download it from the Play Store or your other ways and can use it. It's free of cost to be used. Just to summarize, anthropometry is a very valuable tool which all of us should use. Please use growth charts for plotting of children below the age of 18 years. They are inexpensive and also decrease the number of tests which we can plan for the children. I think I'll stop here because of lack of time. If you have any queries, I'm open to questions or we can discuss this when we have breakfast after this. Any questions?